Congenital pulmonary airway malformation is a mass of abnormal fetal lung tissue that forms during pregnancy. This mass or lesion is usually located in one lung and it doesn't function as a normal lung tissue. Before explaining congenital pulmonary airway malformation, it is important to know about the normal number of lobes in each lung. Everyone has 5 parts of their lungs. These are known as lobes, with the 2 on the left and 3 on the right side. Occasionally, a problem occurs during development, resulting in one of the lobes containing fluid or spaces or cysts rather than lung tissue. These cysts can be detected on ultrasound before birth and have various appearances ranging from a small number of large cysts to a large number of small cysts. When this happens, the baby is said to have congenital pulmonary airway malformation. What causes congenital pulmonary airway malformation? The exact cause is unknown, but it is known that this is very rare condition. It occurs in about 1 in 10,000 babies. What specific tests are offered in congenital pulmonary airway malformation? Because we don't know the exact cause of this abnormality, there are no specific tests to find the reason why it happens. However, patient is sent to the expert in fetal medicine who do thorough ultrasound scan and thereafter offer the follow-up regular scans. Does CPAM affect the baby before delivery? Occasionally, the baby with this condition do not survive the pregnancy. More often, however, the cysts do not grow rapidly and may not grow at all. Does CPAM affect how and when will a baby be delivered? This condition is not an indication for cesarean section. If there are no other complications in the pregnancy, patient can be allowed to deliver in the same fashion as any other woman without having this condition. What happens to the baby after delivery? This depends upon whether the baby has breathing difficulties or not. Babies with breathing difficulties are admitted in neonatal units to help them with the breathing, and sometimes surgery is performed. Now, the proportion of bronchopulmonary foregut malformation in CPAM is 30 to 40%, while it is 0.15 to 6.4% in case of pulmonary sequestration. The multiple lobes communicate with the proximal airway in case of the CPAM, while these are not connected to tracheobronchial tree in case of the pulmonary sequestration. The blood supply in case of the CPAM is pulmonary artery and veins. In case of pulmonary sequestration, it is systemic arterial supply, branch of the aorta. Venous drainage is via pulmonary vein or the systemic veins. The associated anomalies in case of the CPAM include cardiovascular anomalies, renal hypoplasia, chromosomal abnormalities. In case of the pulmonary sequestration, the associated anomalies include the cardiac anomalies, the diaphragmatic hernia, the gastric duplication. Congenital pulmonary airway malformation is one of the fetal anomalies. The other anomalies include anencaphaly, hydrocephalus, spina bifida, encephalocele, cardiac anomalies, renal anomalies, GIT anomalies, the torch infections, twin pregnancy, abnormal knuckle translucency which occurs in Down syndrome, epilepsy associated abnormalities, diabetes associated abnormalities, the different drugs and associated abnormalities with them, cystic hygroma, omphalocele, gastroschisis, exomphalos, congenital diaphragmatic hernia, meningomyelocele, duodenal hernia, choroid plexus cyst, echogenic bowel, holoprosencephaly, ventriculomegaly, congenital pulmonary airway malformation, which we explain here, cleft lip and cleft palate, fetal hydrops, duodenal atresia, Carey malformation, and the Porter syndrome. Here we have ultrasound picture of holoprosencephaly. Here the hydrocephalic baby is compared to the normal one. Here we have a picture of spina bifida. This is encephalocele. Here we can see the fetal cardiac anomalies. The fetal renal anomalies can be seen here. Here we can clearly see the fetal GIT anomalies. This picture shows the Porter syndrome, and the different characteristic features include bilateral renal agenesis or bilateral multicystic dysplastic kidneys, resulting in reduced fetal urine excretion and oligohydramnion causing fetal compression. There are also Porter facies in the Porter syndrome and pulmonary hypoplasia causing respiratory failures. There are also certain limb deformities associated with the Porter syndrome. So thank you so much. That was all about congenital pulmonary airway malformation and certain other fetal anomalies. Subscribe on Obs and Gynae. Thank you so much. Allah Hafiz.